Good morning, good afternoon, or good evening, wherever you're listening from. My name is Eric, and this is the Five Head Podcast.
They have made a decision that they would rather give taxpayer-funded benefits to illegal aliens than to keep the doors open for the American people.
The Democrats want to provide taxpayer Medicaid dollars to illegal immigrants. Your response?
I don't know what they're talking about. They're focusing on something that is not real, that doesn't exist, and none of us are actually demanding.
So which one is true? Republicans are claiming that Democrats are trying to sneak funding into the budget that pays for health care for non-citizens. Democrats are claiming that is absolutely false. Taxpayer health care for non-citizens is 100% against the law, and they're not trying to change that. And both sides are holding their line on those claims. So which one is true? What if I told you both of those things are true? And I'm going to explain how.
I don't know what they're talking about.
So welcome to the 10th episode of the Five Head Podcast. Before we get into this, if this is your first time listening to the podcast, please check out episodes 1 through 9 on YouTube at Middleview Media and on Spotify, Buzzsprout, wherever you get your podcasts at the Five Head Podcast. And be sure to like and subscribe. Costs you nothing, and it really helps a brother out. So how can this be? How could both of these claims be true? Since the shutdown has started, senators and representatives on both sides of the aisle have been on TV and social media making the same claim for their side. Republicans are claiming that Democrats are trying to sneak in $1.5 trillion in spending to provide free health care for non-citizens. And of course, this is an issue for Republican voters simply because when someone's getting health care for free, all of our premiums go up, our Medicare taxes can go up to help pay for that. So that's the line the Republicans are holding because it feeds into Republican voter support for House and Senate Republicans to not allow the Democrats to add funding to the CR or to the budget. And because of that, it's okay that the government is shut down. So Democrats on the other side are saying this is absolutely false. All we care about is extending the ACA tax credits so that healthcare costs for citizens doesn't go up. And they're willing to hold the line and keep the government shut down by blaming Republicans for allowing the ACA tax credits to expire this coming November. And their voters are okay with the government being shut down for them to hold the line for that reason. So we're going to go through this now and kind of detail the claims so I can show you that both of these claims are actually kind of correct. Non-citizens in a number of different ways do end up getting free health care that ends up being covered by either the taxpayer in the form of Medicare taxes or in the form of continuously skyrocketing premiums. Now, when we go through this, I want you to understand, I'm not explaining all these things from an ideological view. I'm not a Democrat trying to prove why the Republican claim is incorrect, and I'm not a Republican trying to prove why the Democrat claim is incorrect. I'm simply taking these claims for what they are, looking into them, and trying to decide which one of these claims is true, because they're completely opposite claims. So either one side is completely lying, or they're both true in some way. And what I found is they are both true. So first, let's go through the Democrat claim that they are not trying to allot tax dollars to non-citizens for their health care. They're correct in the fact that our current law states non-citizens do not have access to Medicaid. And aside from Medicaid, there's no federal health care. So someone who's a non-citizen can't go to some federal website and sign up for free health care. It's not how it works. When you need health care, you have to go through your employer. And if you don't have an employer option, you need to go through your state exchange. So their claim that it's against the law to give non-citizens free health care is technically correct. Even in their proposals to add money to the budget through this $1.5 trillion that they tried to add before the CR wasn't signed and the government shut down, it specifically states in there that this doesn't apply to non-citizens. So technically, the claims that Democrats are making is correct. They're not trying to hand federal dollars directly to non-citizens for health care. It doesn't happen. It's against the law. Duh. That's where the arguments on social media go. Someone who is a staunch Republican is on every post saying, I'm glad the government is shut down because Democrats want to give free healthcare to illegals. And the response is always, it's against the law for non-citizens to get government-funded healthcare. But we all know that just because something is against the law doesn't mean it doesn't happen. Per that same logic, no one is here illegally because it's against the law to be here illegally. Per that same logic, school shootings never happen because it's against the law to shoot up a school. So the rhetorical arguments are just ridiculous. Just because something is against the law doesn't mean it doesn't happen. However, that doesn't negate the fact that the claims being made by our congressional Democrats are true. Federal law does not allow federal dollars to be handed to non-citizens for healthcare. Now, where the Republicans are also true on this is that in a few roundabout ways, federal dollars are used to give non-citizens healthcare. The first and most obvious one is if someone has a tragic accident and is rushed to the emergency room and needs care, those doctors and nurses and surgeons and stuff like that are going to care for that person without first checking to see if they are a legal resident or not. And I think most everyone would agree with that. Some kid gets rushed to the hospital, take care of the kid, we'll figure the rest out later, right? So I don't think anyone's arguing against stuff like that. But when that does happen and that person is a non-citizen, that cost gets recouped through Medicare. So in that way, Medicare is covering treatment for non-citizens. But that's not what we're really talking about, right? If you're a Democrat or you're a Republican, I want you to comment below something that doesn't bother you, right? Some kid falls off his bike, hits his head, is bleeding from his head, gets rushed to the hospital. Take care of the kid. Do everything you can to make that kid okay. We can argue the politics and who's going to pay for it later. Just take care of that kid. That's not what the complaint is from Republicans. The complaint from Republicans goes a lot deeper than that. And it goes all the way back to ACA being pushed out in 2012 and 2013, which caused our premiums to skyrocket. And with ACA came a bunch of tax credits. So if you are lower income, you can get huge discount on your medical premiums. And what's happening is the eligibility for discount on your ACA medical plan keeps going up. So it used to be the poverty line. If you were below the poverty line, you get discounted insurance, $34,000. Now with like Medicaid Part D and B, we're talking up to $80,000 a year you can make and still get discounted medical premiums. And in order to cover that, the medical premiums for everyone else, for everyone who's not eligible for discounted insurance, is going up. And it's causing this massive divide. You have people that are extremely happy with their medical plans because they only pay $300 or $400 a month for it and they think it's great. And then you have other people who are paying $1,000 to $1,800 a month on their medical premiums, saying that this is ridiculous. Medical premiums have skyrocketed. And then when you find out when someone goes to the emergency room that doesn't have insurance, specifically because they're a non-citizen and they're getting full care for it, it's essentially covered by Medicare because the hospitals are not going to eat costs. You're not going to be able to send a bill to someone who's a non-citizen. And if so, they're not going to pay it. So if you're paying $1,200 a month in medical premiums and then you have a hospital visit, the plan that you have dictates how much they pay for that hospital visit and how much you're going to get in the mail as a bill. And then you're on the hook to pay that. And if you don't pay that, your credit can go down, etc. But if you're a non-citizen, therefore, you're not on Medicare, you're not paying into any kind of insurance plan through the exchange of your state, and you go to that hospital for the same thing, for the same emergency, you're not getting a bill in the mail. And that's what's upsetting people. It doesn't anger Republicans that someone who can't afford regular price premiums gets care. It angers Republicans who don't qualify for these discounts and can't afford the continuing rising costs of medical care and these medical premiums. It's not I don't want someone else to be covered. It's I'm paying an arm and a leg and I feel like I'm not covered. If I'm paying as much as I'm paying, I'm happy that what I'm paying is going to help people who can't afford medical insurance, but it should also help me. I should also be covered because I'm paying as much as I am into it. So then when they hear claims like non-citizens are getting free health care, it's upsetting. And it's a legit thing to be upset about. So for example, I pay nearly $1,100 a month in medical premiums. And I rarely ever go to the doctor. I have been blessed, knock on wood. I don't have any kind of lingering conditions. I seem to be generally healthy for now. I'm waiting for the other shoe to drop one day. I'm just going to end up with a slew of medical problems. But for now, I'm in my 40s and I basically see a doctor once a year for a checkup, get the labs done. I'm told everything looks great and I go on with my life. The only other time I seem to ever need a doctor is if I get injured in some way. And I pay about $1,100 a month in premiums. And what's frustrating about it is not that the premiums I pay go to help people who can't afford insurance. What's upsetting about it is that even though I pay $1,100 a month, even when I go on my annual checkup, I get a bill in the mail. Back when the pandemic hit, I went 3 full years without once going to the doctor for anything. I paid $1,100 a month for 3 years straight. $38,000, whatever it was, for 3 years straight. Then my back went out. I had 2 herniated discs in my back. I got out of my car one day, couldn't stand straight up, out of nowhere. So after 3 years of not even going in for a checkup, I had to go get my back looked at. I ended up having to get 2 cortisone shots because I had 2 herniated discs in my back. And I got a bill in the mail for $1,074 because at the time for that year, I hadn't paid enough into the policy I had for my benefits to kick in. And it was crazy to me. And again, I don't mind the premiums I pay, helping people who can't afford premiums, make sure they get the care that they need. I'm good with that. But I feel like the premiums I pay should also cover me because I'm the one paying them. So even though I hadn't paid enough that year, I'd gone 3 years of paying into the system without seeing the doctor a single time. And I still got hit with a bill. In my eyes, I had like a $37,000 to $39,000 credit because I paid into it for 3 years without using it. So I should have been able to go to that back doctor, get my shots, and not get a bill in the mail and still have a $36,000 credit because I only used $1,000 of it. And that is where the Republican argument lies. It's not about the fact that people who need care get care. It's about the fact that everyone else feels like they're getting screwed with the cost of care because of it. I'm telling you, if premiums were affordable and people went to the doctor and didn't get hit with the bill because they paid enough into the system in order to not get hit with a bill, they wouldn't care at all that someone who is a non-citizen goes to the doctor and gets free healthcare. They wouldn't care. But when ACA was designed to drive prices up for the people who are actually paying into the system so that people who aren't paying into the system can continue to get the same coverage, that is where people start to get upset. And it's a legit thing to get upset about. Okay, so I know I digressed there a little bit with my personal experience and my unhappiness with the current healthcare system. And you might be thinking, okay, Eric, that's great. You're unhappy with how the current healthcare system is. Many people are. And you got some people who want to go back to the healthcare system we had prior to ACA. And you have some people who want ACA expanded into a national healthcare system. But what does that have to do with the topic at hand? So let me get back to that. Is it true non-citizens are getting healthcare funded for them? And I don't mean through emergencies. Because like I said, I think we can all agree, someone gets rushed to the emergency room, just take care of them. We can figure that out. How are they getting federal dollars for non-emergency medical care, like the everyday care, the prescriptions and things like that? Especially when I'm saying that the Democrat claim is true, that is against the law, so it's not happening. So like I said, what's true about that is federal dollars are not going from the federal coffers to non-citizens for their healthcare. But how they are getting Medicaid is through their state. Now, from a pure states' rights argument, it is not actually against the law for any state to institute a state-run healthcare system. As a matter of fact, I think states that want to do it should. And the way it would work is states would propose a state-run healthcare system, just like a national system that like Bernie Sanders has tried to promote on the national level, but on the state level. And they get that bill on the docket, and then the people of the state vote whether or not they want that bill to be passed. And then once it's passed, they can pool their money and they can provide free healthcare to all the residents in their states with their state taxes going up to cover it all. And there's nothing wrong with that. And that could include non-citizens. So a lot of states do this. States pay into Medicaid. The government subsidizes a portion of it. Kind of like with the education budget. Most of their education budget comes from state taxes. And then the remaining budget needs are covered in federal subsidies. However, federal law says Medicaid can't go to non-citizens. That's federal medical dollars. State medical dollars can go to wherever the state wants to allow them to go. So how do you get away with this? If you want to provide medical coverage for non-citizens, but your budget through your state taxes doesn't cover that cost, so you need the subsidies from the federal government. Well, the way you get around that is you take money from other parts of your state budget to cover the Medicare you need in your state, and then you backfill by requesting federal dollars for those budget items which are approved by the federal government to have federal dollars for. So let me just run through an example. Let's say I'm a state, Five-Head Landia, and right now we have a Medicaid budget of $1 billion. And that covers all the citizens in our state, and that is subsidized $200 million by the federal government. So state taxes covers $800 billion of Five-Head Landia's Medicaid, and then the federal government gives Five-Head Landia $200 million to fully cover the entire Medicaid budget. And with that $200 million comes stipulations like we're not allowed to use federal dollars on non-citizens, but I want non-citizens to have Medicaid, which means I need to pay the full $1 billion and not get $200 million from the federal government. So what do? I'm going to take $200 million from my education budget and apply that to my Medicaid budget. That way, my Medicaid budget of $1 billion, which covers non-citizens, is fully state funded, and the federal government can't tell me that I'm not allowed to do it. Now, in turn, I have a $1.2 billion education budget in the state. $1 billion of that is covered by state funding through taxing the state citizens. And every year, I request roughly $200 million of federal education dollars from the federal government. So I lobby to the reps for my state as they're building a budget and they're allotting federal education dollars to all 50 states. Make sure Five Headlandia is written up in there to be approved for $200 million federal education dollars. So I fund $1 billion of that myself through state taxes, and then the federal government gives me roughly $200 million every year so that we can meet the entire educational budget that we need. But this year, what I'm going to do is take $200 million from the state collected $1 billion of educational funds and apply it to Medicaid. That way, I'm not taking any federal dollars for Medicaid. But now, instead of needing $200 million in educational dollars from the federal government, I need $400 million in educational dollars from the federal government. So now I'm going to lobby to my reps in the House and the senators from our state and tell them we've completed the state budget for next year. And usually we need $200 million to meet our education budget needs. But this year we need $400 million. And when our senators and our state reps are asking, okay, before I can lobby this for you in Congress, more education dollars to our state, why? What's going on? And tell them, well, we need more teachers. We've added more Title I programs. The supply costs have gone up. I'm making every excuse so it looks good on paper to make sure I get $200 extra million from the federal government for our education budget. But that's simply because I took $200 million from the state-funded portion of our education budget and put it into the state-funded portion of the Medicare budget, so we're not asking for any Medicare dollars. So from a federal government perspective, they're not losing any money. They're paying $200 extra million to my state for my education budget, but they're paying $200 million less for my Medicare budget. It's kind of a wash to them. It gets buried into a large budget bill when they allot how much money goes to each state and for what. No one's really looking at it. Boom. Now I'm funding all healthcare, not just emergency care, for non-citizens, and I'm not using federal dollars to do it. And this kind of thing happens all the time. States will use up their budgets for the things they want that federal dollars aren't approved for so that they can make claims that they need federal dollars for the things that federal dollars are approved for. And that's why you hear a lot of people make the argument that if they didn't spend so much on their own state social benefits and social programs, they wouldn't need as much federal funding for infrastructure and for education and the other things that federal dollars are approved for. And that's how they're tying federal dollars going to things that are not written into the law that they're allowed to go to. So it's not that it's going directly from the federal government to non-citizens in this example. It's that medical subsidies are going to the state, and then the state is using its own tax dollars to fund non-citizens' health care and recouping that money with federal dollars. Does that make sense? And with that, we can get into a two-sided argument on what the federal government should be covering and what they shouldn't. There's a lot of people out there who feel like the federal government shouldn't be covering any kind of social benefits or social programs at all. That should all be done on the state level. Taxes on the federal level should be lowered extremely. So the federal tax that we pay is actually less percentage than the state tax. State taxes should go up to cover the social benefit that the people of the state all agree that they want. That way it can be different for each state. And that's a legit argument. You can logically work that argument out. And then there's another argument that there should be no state taxes at all. We are one country. It should all be one thing. State taxes should go away. Federal taxes should go up a little bit for everyone. It should go up a lot for the rich. And the federal government should just be providing it all. Federal government shouldn't just be subsidizing another state's infrastructure budget. The federal government should just be covering the infrastructure budget for all 50 states. Same with medical care, same with education benefits, etc. And there's a legit and logical path to work out that argument as well. And if anyone would like to have that discussion in future episodes, please let me know in comments or an email, etc. So that is where we are on this debate between congressional Democrats and congressional Republicans when it comes to the shutdown and the CR that's holding it all up in the infusion of spending that the Democrats want to add to the CR. It is true when the Democrats claim it is against the law for federal dollars to go to non-citizens for medical care. 100% true. They're not lying on that. But it's also true when the Republicans claim that federal dollars do trickle down to paying for medical coverage for non-citizens and other benefits for non-citizens. And this infusion of $1.5 trillion into the CR is going to lead to that. And this is why both parties now can hold the line and let this shutdown continue, at least until, like I mentioned last episode, October 17th. It gives them a couple weeks now where they can play politics on this shutdown, because it won't be until after October 17th that federal employees actually stop receiving paychecks. But that's a couple weeks away, and both Democrats and Republicans can use these couple weeks to play politics and point the finger and try to hold the line on their stance when it comes to the budget. So that's episode 10 of the Five Head Podcast. If you have any comments, debates, questions, you can put it in the comments, or you can email me at eric.middleviewmedia@gmail.com, and I will try to address it on follow-on episodes. Thank you guys for listening. Talk to you next time. Five Head out.